everyone. My name's Leanne Humphreys, and today we're speaking with Simon Rosenbaum. Simon is an accredited exercise physiologist and Scientia Associate Professor in the School of Psychiatry, University of New South Wales. He has extensive clinical experience designing, delivering and evaluating physical activity programs for people with mental illness, and he's worked with a variety of groups including youth, veterans, emergency services workers and refugees. And today, because this is the Disaster Mental Health Hub, we'll be talking about the role of physical activity in supporting people in the aftermath of disaster. So welcome, Simon. I'm really delighted that you're here with us today. Such an interesting area to talk about. You've very kindly overseen the development of our disaster recovery toolkit on the role of physical activity in recovery from disaster. So this conversation is more of a taste test to alert people to this really interesting emerging area of research and practice. So we would really encourage viewers to take a deeper dive into the toolbox materials. But that said, Simon, what are the key messages you'd like our viewers to take away from this very brief conversation?
Yeah, I guess the key thing to think about is that we know that physical activity is an evidence-based strategy for improving mental health outcomes, reducing symptoms of depression, symptoms of anxiety, symptoms of PTSD, also things like psychotic symptoms. There's some good evidence base around that as well. Now, the evidence is so strong that really the argument is that physical activity should be considered as a routine part of care. It's not something, it's not one or the other. We don't put them head to head because really they're targeting different things. Yep. And so saying that usual care should be considered, we should be adding these interventions to usual care. And there's a couple of reasons. One is the mental health outcomes, but two is also the physical health outcomes and actually protecting and promoting physical health. And we know that people living with PTSD and with other major depression, that physical health becomes a big issue, and there's higher risk of things like obesity and diabetes.
Absolutely. Simon, how do you consider the role of physical health in terms of prevention of mental health difficulties?
Yeah, so it's really interesting. We have some good data around showing the preventative effects. So a couple of reviews published in the American Journal of Psychiatry from a few years ago showed when we take that evidence together, if we shifted the population to increase their activity levels by as little as 60 minutes per week, we would prevent somewhere between 12 and 17% of incident cases of depression in the general population. Now, that's regardless of culture, it's regardless of language, and regardless of age. So it speaks to this idea that sport and activity is this transcultural strategy that actually people naturally turn to anyways, communities turn to, and particularly when we talk about the aftermath of trauma or a major incident. We see things like sporting clubs actually being a real key part of community recovery. So it's not just the players and the individuals. Similarly, we know that maintaining physical fitness and maintaining physical health, there's a bi-directional relationship with mental health outcomes as well. So there's a few opportunities there for practitioners, and one of them as well is around this idea of stigma and the fact that sport and physical activity could be a gateway into more traditional mental health services, particularly among groups that are highly stigmatized, or that they have highly stigmatized views around seeking mental health care.
Simon, that's really interesting. Yeah, I guess as you were talking, I was alerted to that concept of 60 minutes. You were talking about increasing by 60 minutes, and that, how do you see that fitting with the current recommendations about levels of physical activity that people should be engaging with?
Yeah, it's a great question. We've got to be careful about those physical activity guidelines. So we have Australian guidelines. We also have guidelines from the World Health Organization. And those guidelines typically recommend around 150 minutes of what we call moderate to vigorous physical activity per week. So a little bit of huffing and puffing, or a little bit of sweating. But we've got to be really careful that when we talk about the mental health benefits of activity, it's actually, you can get those mental health benefits from a lot less. And so really those physical activity guidelines weren't designed with mental health in mind. They were designed purely based on cardiovascular and mortality-based outcomes. If we had guidelines for mental health, the guidelines would simply say something is better than nothing. And really it's about someone's level of activity at the start. And so if we think about, for example, a highly traumatized individual or someone who's really unwell, experiencing high levels of symptoms, maybe not even getting out of bed, we know that in those people, getting up out of bed, walking around the house or whatever it might be, can be beneficial and can help trigger a cascade of events that can help with recovery long term.
Absolutely, absolutely. So, Simon, if you had to give our viewers just 2 or 3 really practical things to take away from this conversation, health professionals, what would you recommend they be doing differently in their work with disaster impacted individuals and communities?
Yeah, it's a good question. Firstly, I'd say think about their own activity and their own health, and part of that is a way of self-care.
Yeah.
The other part to it is we know that health professionals who engage in these sort of behaviours themselves, their views and attitudes towards it changed, and we know that their sort of prescribing practices and the way they work with their patients actually changes as well.
Yeah.
So it's really important that health professionals that set the lead and that we actually
Mm.
ensure that we're active. A couple of other points. One is to separate the idea of aesthetics that's linked to exercise and particularly weight loss. And this is really problematic for a couple of reasons. One, because we know that when we ask people, why do you want to exercise? The number one reason is weight loss. But unfortunately, the data around the role of exercise in contributing to weight loss is pretty minimal in the absence of dietary change.
Yeah.
The reason this is problematic is that it sets people up to fail.
Right.
Because we then have people that we're trying to encourage to exercise. They might start exercising, they might feel better, they might be fitter, they might be more able to lift their grandkids or whatever it is, but the scales haven't changed, and that can be hugely demotivating for people. So it's really important that we separate that and we talk about why we want people to be active, which is because of their mood, because of their sleep, because of their symptoms, and really being open about that. And I think we're seeing a change in the general public around this awareness of people saying, I exercise for my mental health. That's key. And I think COVID's been really interesting with that as well, when we've sort of taken away those opportunities. So that's probably one thing. You go. Yep. You jump in.
I was going to say you're actually recommending that our view of what a mental health practitioner looks like is actually a very different view.
Yeah, absolutely. I mean, given the evidence we have, we'd be arguing, and we know that in terms of exercise interventions, the people who stand to benefit the most are probably the most unwell. They're also the least likely to have access to the level of support required to help them engage in activity.
Yeah.
So what that means is if we know the evidence base, we know the effect that this can have, but yet we're not matching the level of services and the support, we're not matching that to the individual needs, then we're missing a big opportunity there. And one of the key things when we, I think about integrating exercise and physical activity in mental health care is thinking that it's not it's not a secondary issue. And often we work with health professionals who say, look, that's fine. We know this is important, but we have to deal with the mental health symptoms first. But actually, that's not what the evidence tells us. The evidence says that we can do it together. And actually, by doing it together, it's likely to help both the mental health and the physical health outcomes.
So training for mental health practitioners could change. Our view of what a mental health practitioner is can really broaden, and what we offer as health professionals can really change as well.
Definitely. So we're doing a lot of work with training exercise physiologists, physiotherapists, those traditional exercise-based practitioners in mental health, so that they've got the skills in terms of mental health first aid, and so that what they can deliver what we call mental health informed physical activity programs. But likewise, we need mental health professionals to basic training in exercise prescription, physical activity promotion, and how those professionals can actually work together, not one versus the other, but actually simultaneously.
Thanks, Simon. So if I'm thinking about the disaster context specifically, and I'm thinking about communities that can be destroyed as a result of disaster, and the idea that perhaps there's social disconnection, lack of access to usual kind of sporting facilities. So if we're thinking about low resource environments, do you see that as a barrier to implementing strategies to increase participation in physical activity?
No, I think it's actually the opposite. Rather than being a barrier, I think it's an opportunity. And I think that physical activity in those contexts is, one of the most powerful strategies that we have and the most feasible. I've done a lot of work in Bangladesh with the Rohingya community, and driving through those camps, you'll see kids playing soccer with, garbage bags that are tied together.
Yeah.
Some of the work that we did there, we've got stories of women that would wake up early morning, and they went on a walk together around the camp before the men were awake. And this was something that they did because when we sort of asked about why, they told us it was about releasing their tension, which is the idiom of distress and anxiety. Yes. So really, this is it's a natural thing that humans turn to in terms of moving our body, but also the social connection that this brings.
Yes. Yeah.
But again, I think where we're missing the opportunity is that we're not reaching the most vulnerable. We're not reaching those that stand to benefit the most. So, for example, in the camps, when we talk about sport, the agencies that are there, they say, yeah, we organise football tournaments for the young men. Now, that's great, but that's not who needs the support. Those able-bodied young men are going to play. They're going to find ways to play no matter what.
Yeah.
But actually, if we think about the disadvantaged groups, people with disability, women in that context, the ones that maybe are experiencing symptoms or anxiety issues where they're not prepared to engage, they're the ones that we need to focus the services on and actually think about how can physical activity be used as a strategy to not only engage these people to then provide an intervention that can help physical and mental health, but also, again, as a gateway to more traditional mental health services. And we see that here in Sydney as well. If exercise is not, it doesn't carry the same stigma as other services can.
Absolutely. Simon, that's all incredibly interesting. So thank you very much for that. That's really given us a lot to think about. And as I mentioned earlier, this conversation is just a very brief introduction to the materials that you've overseen for us on the Disaster Hub. So for those of you who are interested in understanding more about physical activity and its role in supporting individuals and communities in the aftermath of disaster, I'd really encourage you to explore the materials and resources on the page. Thanks very much, Simon.
Thanks a lot.